Finding an after-hours doctor or a bulk billing GP has never been more challenging, but by the end of February, it will get a lot easier for Victorians. 22 of the 25 priority primary care clinics promised last year will be up and running. However, Premier Daniel Andrews wants Medicare reform to be a top priority at National Cabinet this year.
It's a new year, but Victoria's healthcare system is still under pressure.
It's never been harder to find a bulk billing doctor.
But today, some good news. 22 of the 25 priority primary care clinics promised last year will be up and running by February. The Victorian government have invested $70 million into the scheme. The idea is to provide a free alternative to busy emergency departments when people can't get an appointment with a GP.
Victoria stepping into a gap that's been left by 10 years of neglect from the former federal government in the primary care space.
10 are already in operation. It's estimated 6,000 patients have already been through the clinics. Kerry Tarpey is one of them. She hurt her foot just before Christmas. Instead of spending hours in emergency, she went straight to her nearest clinic.
I was seen almost immediately, sent off for an x-ray, reported on within a couple of hours.
Although it's early days, emergency departments say workloads are already decreasing.
It makes a difference, and I think what's important is that every little bit makes a difference.
Once all 25 are up and running, it's estimated each clinic will treat around 300 patients every week.
This is about filling a gap. It's about dealing with really significant challenges in our Medicare system, in our primary care system.
Victorian Premier Daniel Andrews says fixing the broken Medicare system needs to be a key priority for the Commonwealth, and he'd be raising it at National Cabinet this year. He said it's not the job of the state government, and nor should Victorian taxpayers have to foot the bill.
And that system is broken. You cannot find a bulk billing doctor, particularly out of hours, and that's not the way it should be. That's why this needs to be a key priority for reform around the National Cabinet table in 2023.
Mark Butler has a Medicare task force underway, which is consulting most of the experts, including the AMA and all sorts of other health experts as to how we can rebuild Medicare in this country.
Georgia Simpson, Sky News.